Today I want to mention to you the aspect of nutrition as it relates to autoimmune diseases. At this point in time, however, there's only one nutritional item that's in the literature being effective for autoimmune diseases, and that is vitamin D. Have your doctor check your vitamin D3 level. Ideally, it wants to be somewhere between 50 and 60 nanograms per ml. 50 to 60 nanograms per ml. The quote normal range goes all the way down to 30, but that's not enough, particularly if you're dealing with one of these diseases. So if you're up in that 50 to 60 range, fine. If you're not, take enough vitamin D to get you up there. That's really important. Additionally, diet and immunity are closely related. So what you eat becomes even more important if you've got an autoimmune disease, or if you are even at risk of getting one. Pay even greater attention to your diet in those situations. Be sure to clean up your diet by getting rid of all the processed and crappy foods that a lot of people these days don't realize that they're bad for you, but we know that they are. You want to eat more like your grandmother ate 150 years ago before all this crap was invented. So just stay away from all the processed food. That would be all the food that comes in bags and cans and has ingredients labels and all that. Just whole fresh foods, fresh meats, fresh dairy, fresh eggs, fresh vegetables, fruit, etc. Stay away from all the processed junk. Additionally, go online and you can learn a little bit about what's called an anti-inflammatory diet. That's a diet that eliminates certain foods that have been found by researchers to be more associated with inflammation. So if you've got an inflammatory component to your disorder, I think that might be really important for you to examine the possibility that you're eating too much of those pro-inflammatory foods. Certain nutritional tests are important in this regard. The two most important ones that I can tell you about are called the omega check or the omega index. And this is going to give you the ratio between the omega-6 oils and the omega-3 oils. The omega-6 oils are pro-inflammatory. The omega-3 oils are anti-inflammatory. And if you have too much of those 6s and not enough of the 3s, there's going to be a problem. And just about everybody with an autoimmune disease has that problem. So get that ratio checked. Quest does this, LabCorp does this. Another one to check is something called MTHFR gene. MTHFR gene. One of the two variants of that gene, if you have homologous genetics for that, you're much more likely to become toxic than any other person. In other words, that particular gene, when it's upregulated with two homologous variants, will decrease your body's ability to detoxify. So I think that's very important. And the reason is because you can offset the negative aspects of that gene by taking extra amounts of one of the B vitamins called methylfolate. That's not the same as folic acid, it's different, methylfolate, combined with another B vitamin called methylcobalamin or methyl B12. It's a form of B12. So if you're homologous on one of the variants of MTHFR, be sure to talk to your practitioner about giving you the right amount of methylfolate and methyl B12, and that could make a big difference to your case. I also like to check the vitamin mineral panel that Quest now offers, and I like to see that everybody is at least above median on all the various vitamins and minerals they check. So think about that, and if you look like you're in the lower percentage for any of those vitamins or minerals, why don't you start taking supplements for that? Okay, thanks for listening, and if you want to know more, please leave a comment on my bio. And please forward this to anybody that you don't know might be helped by it. Thank you. Appreciate it.